Good morning, everyone. We are going to talk about ulcerative colitis from an Ayurveda perspective with Dr. Rahul Gupta, who is a senior Ayurveda physician and MD in Ayurveda. Dr. Rahul Gupta, could you please explain us what is the difference from an Ayurveda perspective point of view for ulcerative colitis?
Actually, the ulcerative colitis can be correlated to a group of disorders that is mentioned in different areas in Ayurveda. Generally, it can be correlated with Raktaj Pravahika, Raktaj Atisar, Pittaj Grahini, and Sangrahini. All the diseases that I have mentioned here in Ayurvedic terms are the diseases of large intestine. Rakta Pravahika means that the patient is having bloody uh, stools with uneasiness. Rakta Jatisar means that bloody diarrhea. Pitta is somewhat correlated to the IBS, can be correlated with IBS, and Sangrani is the chronic form of IBS. So these four diseases comes under or can be correlated with the ulcerative colitis in Ayurveda. Now we can be moving on to the causes of ulcerative colitis. Uh, the first cause is Triupstamba Viparya. Actually, our body is there are three pillars which makes the body stable. Out of the three, first one is ahar or food or diet. Second one is nidra or sleep. Third one is brahmacharya or abstinence. Since ulcerative colitis is a disease of digestive tract, the first pillar, that is ahar or diet, is very much important in it. The causes include the stale food. We have a culture of stale food, packed food, tinned food, the food that goes into the refrigeration becomes stale. So it causes ulcerative colitis. Uncooked food culture is also there, so it also causes ulcerative colitis. The meal timings are also very important. So if you take your food in irregular meal timings, it is also a positive factor. Buffet system. That means if you are eating your meals or food by in a standing position, you can get UC. Next one is the mental factors. The mental factors are also very important in ulcerative colitis. If you are not focusing on your diet you are eating, or watching TV, or having a conversation with your friends, or even if you are angry with something and you are eating your diet, the diet is not going to help you anymore, and it can cause any digestive ailment, including ulcerative colitis in the future. Certain kind of food, that is green leafy vegetables, cheese, and packed food is very dangerous. Next one is the second pillar, that is nidra or sleep. Improper sleeping habits is a positive factor. That means if you are sleeping in a daytime, or if you are not sleeping in a night time, then it can cause ulcerative colitis. Third one is a brahmacharya viparya or abstinence. That is excessive or abnormal sexual indulgence can cause ulcerative colitis. The next positive factor is stress. Uh, in Ayurveda, Pitta Dhara Kala is relation with Grahini and Majja Utpatti. Uh, Actually, it means that the our brain, uh, it is in sync with our digestive organs, including large intestine. So the stress factor is very much important, or can cause or clear up the incidence of ulcerative colitis. Next positive factor is addiction. Any kind of addiction, that is excessive alcohol, smoking, chemical abuse, can also cause ulcerative colitis. And last and very important factor that cause ulcerative colitis is skin disease. Actually, skin and large intestine are made up of ectodermal germ layer in the embryo. So since both the organs, that is skin and the large intestine, is made from ectoderm, the disease of one organ can affect the other one. So if a person is suffering from a skin issue or skin disorder from a long time, or if he is not taking a proper treatment for that, it can complicate into ulcerative colitis in later stages. And this correlation is usually ignored because this concept is of Ayurveda only. So it is a very important factor if the patient has a history of skin disease and he is suffering from ulcerative colitis, then we have to incorporate some kind of medication for the skin disease to cure the ulcerative colitis.
Okay, moving on. Let's just talk about the complication and pathogenesis.
Actually, the large intestine in Ayurveda is it is advised that it is told that the large intestine are made up of Rakta and Kapha. Rakta means blood, and Kapha is a basic element of the body that the basic function of the cuff is to provide a lubrication in the body. So the large intestine is made up of Rakta and Kapha. Actually, what happens if a person is suffering from a fever that mostly you can say jaundice and typhoid in his childhood, and if the proper treatment is not given to the for the fever, low vitality tissue develops in the intestine of the patient. It is also called as Khavagun in Ayurveda. And then the positive factors attack on this low vitality tissue and then cause ulcerative colitis. So basically, improper lifestyle leads to colitis, that is called pravahika. And when the colitis is old or it is in a recurrence in a patient, uh, it can call ulcerative colitis. The basic dosh which is involved in the ulcerative colitis as per Ayurveda is a pitta dosh. Pitta dosh is it indicates fire in the body. Generally, pitta is meant for a good purpose, that is for digestion and for other metabolic actions of the body. But when this pitta dosh get vitiated, it starts some kind of allergic reaction in the body, which prevents the healing of the ulcers in ulcerative colitis, and also it leads to the pus formation in that ulcer. Thus it complicates the condition, and hence it causes ulcerative colitis. Now we move on to the complication of ulcerative colitis. uh, Ulcerative colitis, as per Ayurveda, can cause every ailment in the body. First of all, we see many patients with joint disorders who have the history of ulcerative colitis in the past. This correlation is advised as that asthidhara kala, or the formation of bones, is dependent upon the vata dosha. Vata dosha is the air. It can be correlated with the air element of the body. So it is stored in the large intestine of the body. So if the large intestine, that is the uh, production organ, is affected, it can cause destructive changes in the joints of the body. So joint disorder can be a complication of the ulcerative colitis. It can also cause eye diseases, because the eye is a organ, majja organ as per Ayurveda. And since grahani, or digestive engine of the body, uh, do affects the majja of the body, so it can affect the eye disease also. Next one is a heart disease. Actually, the pitta dosh mentioned earlier, one of the one of the forms of pitta dosh, that is sadhak pitta, resides in the heart. And its function, uh, as per Ayurveda, is to promote memory, the short-term memory, is due to the sadhak pitta, which is present in the heart, and long-term memory is due to the brain, not heart. So this pitta dosh get disturbed due to these positive factors of ulcerative colitis. So ulcerative colitis can be complicated into heart disease also. So a single digestive tract disease can cause any ailment in the body. So you must not ignore your condition in this.
So, what would be your advice to someone, who's just thinking, who's just been diagnosed with ulcerative colitis? What should they do?
First of all, you must not panic that you have ulcerative colitis. There are treatment options available in Ayurveda, and Ayurvedic treatment can also prevent your surgical aspect. That is, the modern sometimes advises the patient to go for surgery to avoid recurrence. So, Ayurvedic treatment not only improves the condition, or it can avoid the recurrence, but it improves the quality of life of the patient. So if you have ulcerative colitis, just don't panic. Just find the Ayurvedic doctor which practices on the ulcerative colitis, and you will be well once again.
Thank you so much for sharing this information. Hope it's useful for all our viewers. Thank you so much.